Hello and welcome. Today we'll be exploring a fascinating and complex area of neurology, chromosomal microdeletion syndromes. These are disorders caused by the absence of small pieces of chromosomes, leading to a variety of health challenges, often impacting the nervous system. We'll focus especially on the well-known 22q11.2 deletion syndrome as an example, but the principles apply to others as well. So, what causes these microdeletion syndromes? Simply put, it's the deletion of a small segment of a chromosome. In the case of 20q11.2 deletion syndrome, a tiny piece of the 27 chromosome is missing. This region contains a number of genes crucial for development. These deletions usually occur randomly, either during the formation of eggs or sperm, or early in fetal development. While most cases are new mutations, meaning they are not inherited, sometimes a parent can unknowingly carry a balanced translocation that increases the risk for a child to have the deletion. Now, let's delve into the pathophysiology, how these deletions lead to health problems. The missing genes in the deleted region are responsible for various developmental processes. When these genes are absent or present in only one copy instead of two, it disrupts these processes. This disruption can affect the development of various systems, including the brain, heart, immune system, and palate. In the nervous system, the deletion can affect brain structure, neuronal migration, and synaptic function, ultimately impacting cognitive abilities, behavior, and motor skills. The exact mechanisms are still being researched, but the disruption of crucial developmental pathways is the underlying cause. Regarding epidemiology, 22q11.2 deletion syndrome is the most common microdeletion syndrome, affecting an estimated 1 in 4,000 live births. Other microdeletion syndromes, while individually rarer, collectively represent a significant portion of genetic disorders affecting development. Because genetic testing is becoming more prevalent, it's likely the detection rate of these syndromes will continue to increase. The signs and symptoms of chromosomal microdeletion syndromes are highly variable, even within the same syndrome like 22q11.2 deletion. Neurological manifestations can include developmental delays, learning disabilities, speech difficulties, attention deficit hyperactivity disorder, ADHD, autism spectrum disorder (ASD), and seizures. Physical features might include characteristic facial features like a small jaw, wide-set eyes, or cleft palate. Other common problems are congenital heart defects and immune deficiencies. The combination and severity of these symptoms varies widely from person to person. Diagnosis typically involves a combination of clinical evaluation and genetic testing. If a doctor suspects a microdeletion syndrome based on a patient's symptoms, they will likely order a chromosomal microarray analysis, CMA, or fluorescence in situ hybridization, a FESET test. These tests can detect the presence or absence of specific chromosomal regions. In some cases, whole exome sequencing of WES might be considered. Early diagnosis is crucial to allowing for earlier interventions and improved outcomes. While we are focusing on the general principles, it's important to remember that there are various microdeletion syndromes beyond 22q11.2 deletion. Some other examples include 36 deletion syndrome, Williams syndrome, caused by a deletion on chromosome 7, and Prader-Willi syndrome, in some cases caused by a deletion on chromosome 15. Each syndrome has a distinct set of clinical features, but they share the underlying cause of a missing chromosomal segment. Treatment and management for chromosomal microdeletion syndromes are largely supportive and symptomatic. There is no cure as we can't add back the missing genetic material. However, early intervention programs, speech therapy, occupational therapy, physical therapy, and educational support can help individuals reach their full potential. Medications may be used to manage specific symptoms such as seizures, ADHD, or anxiety. Cardiac defects and immune deficiencies often require specialized medical care. Currently, there is no way to prevent chromosomal microdeletion syndromes from occurring in the first place. Because most cases arise spontaneously, it is impossible to predict who will be affected. For parents who already have a child with a microdeletion syndrome, genetic counseling can help them understand the recurrence risk for future pregnancies. Prenatal testing, such as amniocentesis or chorionic villus sampling, can be used to detect chromosomal abnormalities in a developing fetus. The prognosis for individuals with chromosomal microdeletion syndromes varies greatly depending on the specific syndrome, the size of the deletion, and the severity of the associated health problems. With appropriate medical care and supportive therapies, many individuals can live fulfilling lives. Research is ongoing to better understand the underlying mechanisms of these syndromes and to develop more targeted treatments. Advances in gene therapy may someday offer a potential cure, but that is still in the future. Current research focuses on understanding how specific genes within the deleted region contribute to the various symptoms, and on developing interventions to address specific neurological or cognitive challenges.